Hey guys, good afternoon. How are you guys doing today? I hope you guys are having a lovely day. Here we have a very special guest, our lovely Dr. Porter. We're gonna be asking her some questions, and also, you guys, if you guys wanna ask her, yourself some questions or some doubts that you guys may have, you can just put them in the chat. We'll be going over them and she'll answer them, okay? So let's get started. We are going to be asking her a couple questions related to tummy tucks. We're going to be going over by the topic. So, again, you guys, any questions you guys may have, just put them in the chat, okay? So, Dr. Porter, can a tummy tuck correct a C-section shelf or scar indentation?
Yeah, so usually the C-section scar is a little bit higher, and then we can make the incision a little bit lower too. But yeah, your abdominoplasty scar will be longer than your C-section scar, or depending on where you got it done, if you have like a vertical one, but it removes all of it.
Okay, great. Is it true that I should wear a binder first and then a compression garment after getting a tummy tuck?
Yeah, just because after tummy tucks you have 2 drains. There are some surgeons who do drainless tummy tucks. That's great if you're local, but not so much if you're going far away, because we need those drains to see how you're healing and to know how much you're draining.
Of course.
And then you can, after they're out, you can switch to the garment.
And how long would you say that the drains take for it to be taken out?
Around 10 days.
Okay, great. Short. So, we have another question here that says, what role does lymphatic massage play in tummy tuck recovery?
Lymphatic massage in a tummy tuck, it does get rid of some of like the fibrosis and some of the fluid. You do have those drains. I would say that it's not as mandatory in a tummy tuck as it just like straight up liposuction.
Oh, okay, great. So you would say that massages, how many massages do you think, for example, a patient should get if they have a tummy tuck done?
I mean, we really don't want people messing with the incision so much, but on the back or something, the sides, we do lipo. If you're having more extensive lipo, then you need more massages, or it's more beneficial for you to have more massages. If you're just getting a tummy tuck, just maybe a few.
Oh, we have a lovely comment here that says, I'm booking with Dr. Porter now. That's so great. That's so great. All you guys have to do is leave your information right here in my left bottom corner. You're going to see this folder. For anyone that would like to schedule a free virtual consultation or a free in-person consultation with our lovely Dr. Porter, all you have to do is put your information right here, okay? For April 15th. Wow, that's amazing. That's great. So excited for you. So, we have another question here that says, how soon after surgery can a patient resume core exercising or weightlifting?
So, depending on the type of surgery, if it's straight up liposuction, no BBL, just lipo, you can start working out in like 3 weeks. No heavy lifting more than 15 pounds, for that 3 weeks, and then walking always mandatory after any surgery. But like any cardio or anything, you start light, build up. You can do like 3 weeks after lipo. If it's anything else, especially like tummy tuck, breasts, where we have these sutures that are carrying some tension, then it's 6 weeks.
Okay, great, you guys. So we have another comment here that says, yes, I have mine booked with her. That's amazing, girl. I know you're gonna look amazing. She's really the GOAT, you guys. So, as I was saying, we have a question here related to BBL. How many additional lipo areas can I add to my BBL?
So traditional, a BBL can really be done if you have like a lot of abdominal fat. You can technically just do the abdomen. We usually do Lipo 360 here and then fat graft. But you can do arms, chin, thighs. Just keep in mind that there is a legal limit in Florida of 4 liters. So if you are adding some of these extra areas, you may be sacrificing some additional lipo in like the abdomen and back.
Very important. Remember that, you guys. Very important. So I have a question here that says, is it true that BBL volume decreases over time?
Yeah, so some people say that they don't, but maybe they're just really lucky, but about 50% of the fat that we graft won't survive. So in the beginning, we try to graft more than we think that you may need or want, because some of it will shrink.
Of course. So what would be some tips for someone that really wants to avoid or like try to maintain as much fat as they possibly can?
I always tell everyone don't sit or put like extended pressure to the bottom for 4 weeks. Every surgeon has a different rule. Some is you'd sit right away, some is 6 weeks, some is 3 weeks. 4 weeks I think is manageable enough for the patient, and maybe if I say 4 weeks, they'll do it for 3. And then no smoking, definitely no smoking after surgery.
And why would you say it's so important for them to not smoke after surgery?
Smoking decreases blood supply, so that fat has to get blood to survive. And then, anytime that you're smoking, that's why most of us don't operate on smokers. If your nicotine test comes back positive, you got to reschedule for like 6 weeks. The nicotine causes vasoconstriction, which narrows your blood vessels and can cause skin, fat, everything to die.
Oh, wow. So very important to remember that, you guys, we cannot be smoking because the fat that she has put in your buttocks can die, okay? So I have a Lipo 360 tummy tuck and BBL booked with you. Any advice? I mean, she means any advice for her to prepare herself for surgery.
So just do what you're already doing. If you have, if you want to lose a few extra pounds before surgery, that's ideal. Again, surgery is not gonna, I haven't seen your photos or anything off the top of my head, I don't know. But if you have like intra-abdominal fat, we can't remove that with surgery, but just probably keep living your life as you normally do. And then a lot of the work comes after surgery. So
any vitamins that she should be taking? Or
you can take just a multivitamin is good, or prenatal vitamins. Have everything that's necessary.
Really great.
Yeah.
That's great. So yeah, you guys, you could take vitamins so that way, you can feel like you're maintaining your body and helping your body to be ready for surgery, okay? What comes with the Lipo 360? We have a question here.
So the abdomen, it's the top of the abdomen, the bottom of the abdomen, sides, and then on the back, it's like your mid-back up to like kind of the armpits and down near the love handles.
Yeah, you guys, so that's why it's called Lipo 360, because a 360 is a full circle. So it's, how she was explaining, it's a full circle of your whole torso, okay? So we have another question here that says, after BBL, the skin becomes sensitive. Besides massages, what other methods can it help improve healing?
So regardless of what you do with any type of plastic surgery, we're always kind of disrupting those nerves and stuff. So you'll be numb at first or hypersensitive, and then like as time goes on, you may feel like pins and needles and stuff. There's not really anything that you can do to stop that. For bruising and stuff, if that's what that question is for, arnica can help. I mean, some people say it works, some people say it doesn't, but usually people have a good experience with it.
Okay, great. And how long would you say that the buttocks stays a little stiff for after BBL?
I mean, just plan for like a month, maybe longer. You're gonna see your final results at about like, a year. When all the swelling, everything has gone down, inflammation, stuff like that. It takes a long time for the soft tissue to kind of get back to normal.
Okay. So we have a question here that says, is it true that a BBL recovery can take up to 6 months, including fat cell reabsorption?
Yeah, so most of the fat that's going to die is going to die within like that first 4 to 6 weeks. So that's why we really harp on no sitting, no smoking, walking and stuff, but no weightlifting or anything. And then, your final results with the BBL, and that includes like liposuction and how everything's gonna, like the final result, it's about a year.
Oh, okay. That's great to know. What roles does compression play in shaping results post BBL?
So compression is really good for swelling. What people don't realize is that after lipo, after tummy tuck, we're taking this fat, and like in a tummy tuck, we're completely removing it from one area and pulling it down. In liposuction, we're traumatizing the tissue kind of to get it out, and your body heals by inflammation. So you swell up like a balloon. So the compression helps with the swelling, helps with the fluid collection. It's going to make you feel more comfortable.
Yeah, you guys, so it's very important, like how she's saying, as the weeks go by, those results are only going to get better and better and better. Your waist is going to be getting smaller and smaller as the time passes by. Okay?
But, I mean, at first, like post-op day 1, or 0, you're very flat. And you're like, oh my gosh. And then maybe after 2 weeks, you feel like you gained weight or something. And that's all from swelling. You swell. And then at 1 month, like half of it goes away.
Yeah. Great. So now we have a question here that says, how can I determine if I am a good candidate for breast augmentation or a breast lift?
So if you, it all depends on where your nipple sits on your fold. So where the underneath of your breast meets your chest wall or the inframammary fold. If you're not sure, you can look up like stages of ptosis for breasts, and that's kind of what it's called. So if your nipple is like above that fold, then usually you can just get away. There's a caveat to that, but usually you can just get away with an augmentation. Sometimes people have pseudotosis, which means that the nipple is fine, but the glandular tissue is kind of just like hanging below. Then you may need. It's best to come in for a consult in that situation, or any situation really. And then if your nipples are like pointing down or like way below that fold or something, or at it, then you probably need a lift.
Oh, this is so nice. I'm so excited. I just submit my pictures with Alexis. I'm waiting to hear back to book. Nice. We're excited for you. How do I get a virtual consultation with Dr. Porter? So, Julie, all you have to do is put your information right here in my left bottom corner. You're going to see this blue folder. All you have to do is put your phone number, your email, whatever is the best way of contact so we can get in contact with you immediately, and that way we can schedule you for a virtual consultation with Dr. Porter, okay? Mm-hmm. Great. So, we have a question here that says, how do you decide which incision technique to use?
For what?
For a breast lift.
Okay. So it depends on this, for a lift or for an aug, I usually always put them in the inframammary fold. It's the safest way to do it for the most part, and you get the best visualization for like to cauterize anything that's bleeding or anything. It's just a safety thing for me, and it's pretty well hidden. For a lift, not many people can get away with anything that's less than a T. There are some that like maybe just a vertical, but most people, I know that nobody likes the scars or everything, but a lot of people heal pretty well. Some, if you're prone to keloids or something, then yeah, there's nothing really we can do to prevent that besides maybe steroids. We kind of have to wait and see with that. But what we're doing when we're making that T scar, you make around the nipple, you're making the nipple smaller, or the areola. A lot of times it splays out over time, so you make it smaller. You're moving it up so that it's at the position that it once sat at when you were younger, and then the vertical incision is kind of pulling the tissue, decreasing the tissue like from the sides, and then from up the distance between the nipple and the inframammary fold. So you kind of need all those incisions to have like the ideal shape.
Can you answer the question I posted before, please? Repeat your question. Just type it out for me one more time. And doctor, would you say so when can a person start using scar gel cream or scar gel,
After 3 weeks, post-operatively, but as long as all incisions are closed. Sometimes in a tummy tuck or in a breast lift at certain areas where there's more tension, there might be a little bit of opening, and that's fine. It just takes time to heal, but don't use the scar tape on that specific area.
Okay. So those silicone scar tapes you wouldn't recommend, that you would recommend a scar gel?
I like the tapes better. Some people like the gel better.
Yeah, you guys. Okay, great. Okay, so if you could finish typing out that question so I could read it out to the doctor, okay? So we have a question here that says, what are the options for reducing the size of the areola during a lift?
Yeah, so we use a cookie cutter, which is a tool. So that's like the first step is we use that round cookie cutter, and I think usually between 38 millimeters to 40 for circumference. So yeah, it's pretty standardized.
Okay, great. So we have a question here that says, is it better to get a tummy tuck first or a lipo if I have loose skin and fat?
So it depends on your goals. Ideally, if you have a decent amount of fat and some loose skin, if you're okay with having the loose skin because you need like a year in between these procedures, the best way I think to do it, but it takes time, is that you get lipo, and then you can get the BBL, and then you can come back if that excess skin bothers you or something. But at that point, we might be able to even, like, because you're going to be smaller, your tummy tuck incision may be smaller, you might be able to lose if you have intra-abdominal fat during that time and really hone in on what you, like your ideal, body without that extra fat that you were carrying around before. If you do it in the reverse, you can't be as aggressive when you're doing a tummy tuck with lipo, just because you have to watch out for the blood supply. And if you're doing the tummy tuck and then you come back later for lipo, there's a chance that you may have loose skin again. So.
Oh, okay, that's great to know. Can J-plasma be added to all the areas where lipo is performed? What do you think, doctor?
Yeah.
And what would you say, what's the function of J-plasma and how can that help?
So J-plasma is like a helium-based laser that goes under the skin, so it kind of helps with skin contraction. So if you're kind of on the borderline of having potentially having loose skin after lipo and you don't want to commit to that incision, or if you have, I had a patient who had pretty significant keloiding, wasn't ready to commit to a tummy tuck incision. The J-plasma was really good for her. She had some loose skin. Now, it's not going to provide what a tummy tuck can provide. You're still going to have stretch marks there, and if your skin isn't of good quality in the first place, there's not really a guarantee that it's going to work. So it's best in patients that have like good skin to begin with and just like are kind of on the borderline.
Would you say that when you add J-plasma to your procedure, whether that's lipo or tummy tuck, would you say that the J-plasma affects your healing process, makes it longer? Is there any different changes with your healing with J-plasma?
Some people experience, because it does burn like kind of from the inside out, so some people say that it is a little bit more painful right away. I don't really notice that much of a difference with healing. The only thing is I have noticed that some people do tend to drain larger amounts, or like I've seen like a male who had it done with gynecomastia and he did have recurrent seromas, but that's kind of popular with gynecomastia anyway, just more fluid collection potentially.
Okay, we have a question here for you, doctor, and it says, do we have to get massages after a tummy tuck?
No, you don't have to. It's good for the sides and stuff, and then any out-of-town patients who are, it keeps you coming back here, it keeps the staff taking a look at you every day if I'm busy in the OR or something, and these are people that I work with that I trust, so I kind of like it, selfishly. I think you get better care, but...
Would you say, for how long does someone have to stay in the city? Let's say someone's out of the state or outside of the country. For how long would you say that they have to stay in Miami after a tummy tuck or a BBL?
So I say usually about a week, whether people always give me that or not. That's my official recommendation. And then for a tummy tuck, you do have those drains in longer. I would prefer to see them come out than some random person taking them out. But usually around 10 days to 2 weeks for tummy tucks. And then if you're having like a more extensive surgery done, like combo procedures or something like that, it's better to stay longer, just because it's more surgery, there's more complications that can potentially happen.
Okay, great. So with the tummy tuck drains, you said that it would be around for how long?
10 days.
10 days. And for BBLs, it would be for how long?
So if you're from area locally where you Miami patients or like Fort Lauderdale, Keys or something where you can easily come to the office, you don't need a drain. It's more so for people who are flying back like states away or just like further away that it's more of a pain in the butt, and it's really just to kind of prevent a seroma and that's specifically for BBL lipo. For tummy tucks, you probably would still get a drain.
Okay, that's great to know. So we have a question here that says, is it true that massages help prevent fibrosis? How many sessions are recommended to avoid it? Talking about liposuction.
Yeah, so it does, and it also helps with the swelling, helps get fluid out. For the first month, for the first few weeks, I would say like every other day, every 3 days. I can't give you an official number. I mean, it's technically not required, so it's whatever you can afford. But again, it does really help with the fluid, getting it out, with the fluid buildup, swelling, and stuff like that. So.
And would you say, is there any cure for fibrosis?
Depending on if there's like a band or something, sometimes steroids can help, or just like if you have like arm lipo, just like range of motion exercises. But we are causing trauma to the skin, just like how when you make an incision, you get a scar. You're gonna have some sort of degree of changes there.
Yeah, of course. So we have our last question, and if you guys have any questions for Dr. Porter, you can just put them in the chat. I will be reading them out to her, okay, you guys? So the question is, how soon can a patient return to physical activity after lipo?
Well, you can up and walking like the day of surgery, nothing crazy, but then after that, like the more that you're walking and moving around, like 10,000 steps a day, I'm happy. If you want to go back to like the gym and stuff, I wait about 3 weeks because of swelling and everything, and you're leaking like the first few days to a week, so you don't want to be leaking all over the gym. Yeah. But like 3 weeks before you can get back to your normal routine, but we're probably gonna have to ease back into it.
Of course. So gym, and for the people that like to do Pilates, you would say 3 weeks too, right?
Yeah.
Okay. And no heavy lifting, just easy cardio and build up to it?
For about 3 weeks, yeah, and then nothing more than 15 pounds, and then you can resume lifting. There's no real reason why with just lipo you can't be lifting, other than you're not gonna want to.
Yeah, it might feel a little uncomfortable for you guys, so just always listen to your body, like how the doctors say. Very important to take that in consideration. Even if you were super gym girl, super gym guy, how she was saying right now, the doctor was saying how it's better for you to build up to it, okay, you guys? So thank you so much, Dr. Porter, for having us here today. Thank you so much for giving us your time and answering all of our questions. Thank you guys for joining the live today. I hope you guys are having a lovely day. And for everyone that wants to schedule a free consultation with Dr. Porter, whether it be virtual or in person, for everyone watching me outside of the country or outside of the state, no worries, you guys. We got your back. We have virtual consultations. All you guys have to do is put your phone number right here, your email right here, so we can get in contact with you, okay, you guys? Thank you so much. Again, thank you, Dr. Porter. Have an amazing day, guys. Bye.